Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
So Dr. Fauci said that it seems that the UK kind of rushed their review of this vaccine that they approved. How dangerous is that, and what does the FDA do differently?
Okay, the FDA is notoriously the most strict and comprehensive reviewer of medicines and vaccines. So, the FDA usually takes longer than everybody else. But I think the statement that the UK Medical Council that reviewed the data rushed to judgment, we're talking about maybe 7 or 8 days earlier. I don't think that's the case at all. There's plenty of good vaccine people in the UK, France, and other countries that are quite capable of reviewing the data appropriately. So I think that's a misstatement.
The CDC also yesterday, we didn't get around to talking about this, shortened the quarantine time if you're exposed to someone who's positive from 14 to 7 days. Is that because there's some new data out there, or is that just because people weren't following 14 days and they thought, oh, maybe they'll do 7?
No, it's not arbitrary. There's data. So the virus comes in a very big way about 2 days before you get sick. Then the first few days you're sick, it's very high. And then it starts going down very quickly. And at day 7, there's hardly any left. It may have gone down in your lungs, you may get pneumonia, but you don't have any in the upper respiratory area, and you're no longer contagious. It's hard to study because the molecular tests don't tell us if the virus is alive or it's just a piece of a dead virus or whatever. But they've done some more sophisticated testing, and really after 7 days, it's pretty much gone. There's now a few people who continue to shed the virus, people with some underlying diseases and stuff. So it's a little bit dependent on the person. But for the most part, after 7 days, it's gone.
All right, let's take a look at viewer questions. With these vaccines coming out and having to be stored well below zero, what would happen if in transit the vaccines are exposed to warm temperatures? Would they be useless or less potent?
They'd be useless or less potent. This person understands. Fortunately, the way they're shipping these things in these big dry ice coolers, there are monitors on the shipment containers. There's monitors as they ship it over in the airplane and monitors when they get it into this container thing. There's monitors on the minus 94 degree Fahrenheit refrigerators too. So if the temperature does go up, it is noted, and basically an alarm goes off and a recording is made. So they know if it's been out of the zone, out of the temperature zone, and then that vaccine is discarded.
All right, next question. Will a vaccine help those in the hospital affected with the virus?
No, it's not. It's really not for treatment. This is strictly for prevention.
Gotcha.
All right, if someone has recovered from COVID recently and 4 weeks later someone else in the household tests positive, what precautions does the first person need to take? Do they need to quarantine? Can they safely be around others or in public?
They're pretty much safe. There's really very few patients don't mount a good immunologic response. I mean, it's really handfuls of patients. And so after you've recovered from COVID, you're not going to get COVID again 99.9% of the time. So, I mean, use common sense, but you don't have the whole issue about quarantine and somebody who's already had COVID is really kind of a moot point.
All right. If you have a question for Dr. Murphy, you can post it on our Morning News Facebook page. We'll talk to him again tomorrow. Thanks, Doctor.
Great. Thank you.
Thank you.
Have a good day.